So research shows the most prevalent artificial dyes are in thousands and thousands of products, with the top three most used dyes being red dye 40, yellow dye 5, and blue dye 1. The number of states across the country, a number of them are already pushing to ban those dyes and other additives, proposing a variety of restrictions, with California and West Virginia already having legislation in place, reflecting a bipartisan push toward a safer food system. So for more insight, I would like to welcome back board-certified pediatrician Dr. Diane Hess. Dr. Hess, great to see you again. We've certainly talked about this very topic before. What is your reaction to this latest move just yesterday, this announcement by the health secretary?
Well, I think it's fantastic because finally somebody's putting children first. I think as parents, as a pediatrician, anybody who's been around children, we know when we give them these artificial food coloring substances, whether it's candy or juice or drinks, they kind of get bonkers. And I don't think you have to be a physician to know that when you give your child something without artificial colors, they behave better.
All right, so let's take out the behavior aspect of this. You practice
Okay.
medicine with a special focus on pediatric and young adult obesity. How impactful are processed foods, are food dyes? Because there's certainly a group of people who don't necessarily see the connection.
Oh, it's dramatic. So many of these additives that we see in foods are actually endocrine disruptors. So they actually affect the child's development. And you have to remember that children are much smaller than adults, and they're getting a lot of these concentrated additives at a very young age when they're still developing. And this can affect their thyroid and other hormones. So we're definitely seeing that that a lot of these additives are obesogenic, particularly nitrates and nitrates added to meat. They put them in to enhance food color, the color of the food, and sometimes the flavor and how long it lasts. And we know that these are very damaging to children for their development and for obesity, especially the thyroid.
And what about connections to possible illness? Because that's something we also have heard the health secretary talk about.
Yes, so numerous food dyes are connected to cancers. So we know that they're connected to cancers in lab rats. And we know that they're also connected to other forms of chronic inflammation. And we know that now a lot of inflammation in the body is what leads to chronic disease in America. And we have an extremely high rate of adults and children with chronic illnesses in this country. So we're trying to dial back and use natural food coloring and natural unprocessed foods. It's pretty,
Yeah.
you know, it's pretty easy when you think about it, but it's all about money is really what it comes down to.
Right. And it's so interesting, you mentioned the inflammation, because I think so many people don't realize they are chronically inflamed. Dr. Hess, I'd like to listen to a bit more of what the health secretary said yesterday.
We're getting food companies now and fast food companies who are calling us almost every day and asking us, how do we do this? What do you want us to do? I think they're ready to change the industry. They have children too. There's no such thing as Republican children or Democratic children. Their children are going to the same schools. They're eating the same foods as the rest of us. And I think most of them really want to have a healthier America. They want clear guidelines, and they want to know what they can and can't do, and we're going to give them that.
All right, so this is kind of a two-parter. Last question for you, Dr. Hess.
Sure.
What do you think these changes will mean going forward? And then what other broad changes would you potentially like to see implemented?
Well, I think going forward, people think this is going to happen tomorrow. And we still have to be very vigilant about what we feed our children, because a lot of these changes are not going to happen until 2026 in school foods, and then 2027 or 2028. And it's voluntary. It's not mandatory. So we want the food industry to get on board, but it's not mandated yet. And that's going to be a big difference if we have to mandate it. Some of the food dyes, yes, like the red 3 is going to be mandated, but not all of the food dyes. So we want them to voluntarily do this. We want the industry to come and say, we want to make America healthy again. We want to make our children healthy again. And then for me personally, a lot of it is the packaging. So we have to remember that a lot of the packaging that our food that we are eating and our children are eating come in plastics. And that is where a lot of the endocrine disruptors are as well. So we have to make sure that it's not just the food that we're eating, but also the packaging that our food is stored in is not leaching into the food and exposing us to other carcinogens and other inflammatory chemicals.
Thanks for watching. Go to joinnn.com to find NewsNation on your screen. And don't forget to click the red subscribe button below to get more of NewsNation's fact-driven, unbiased coverage.